you for watching Self-Care for Caregivers, a video filmed as a part of our Living Better Together COPD Week initiative. The organization that we represent is Respiratory Health Association. So Respiratory Health Association is a patient service and advocacy organization based in Chicago. Our mission is to prevent lung disease, promote clean air, and help people live better through education, research, and policy change. We welcome you to our COPD educational series in which we work to address current issues surrounding COPD management and care. I'm happy to introduce Dr. Harvey Wolf. He is joining us. He works in private practice as a licensed clinical health psychologist who has over 30 years of experience of caring for individuals, families, and healthcare workers living with chronic illnesses like COPD. Today, Dr. Wolf will be speaking about the importance of caring for COPD caregivers and how caregivers can practice self-care. And I'll turn it over to you, Dr. Wolf.
Good to see you. Good to be here. Thank you very much for, again, asking me to be a part of something that the Respiratory Health Association is doing. It is a very important and very impactful organization that has my full and forever support. So thank you for that. When I was working on thinking about what I wanted to speak about today, I thought of two titles, actually. One was From One Caregiver to Another. I am a clinician, yes, but also a caregiver. And Permission to be human, giving yourself permission to be human. So what I'm going to talk about is four things. I'm going to talk about caregiver burnout. You've heard about this before, but we have some new research on this that I think talking about it and naming it will be helpful to caregivers. I'm going to talk about what burnout is, causes, the signs, how to prevent it, and how to provide self-care and how to honor yourself and the big, huge job that you have as a caregiver of a loved one or a friend. So let's get started. Some of the causes of burnout that we see are when you are put in the position of caregiving for a loved one, a friend, somebody that you've had a specific role with, such as a wife or a husband, a friend, a brother or sister. That role changes from that relationship to being a caregiver and a spouse or a brother or sister, and that can get to be confusing at times. So you are both, but primarily you are a caregiver, and you are coming at the caregiving with a full heart and with dedication, but it's difficult. There is the felt sense that by doing the caregiving, that it'll be a positive experience, that it will be impactful, and you start to realize that it's an adjustment on both sides, that you're learning, you're in a big learning curve of learning new things, learning how to caregive. It's not easy, is it? And the person who is receiving the care is adjusting to a new role as well. You're still together, but you are in different positions. So being a caregiver versus being a care receiver. The other thing is, at times, it is a very hard job, as they say, 24/7, and at times feeling unsupported, maybe even feeling invisible or misunderstood, or that you're not feeling that you're as impactful or as appreciated as you thought you might be. I know when we give a gift, we don't expect something back, but we're human beings, so we run into human nature. We are all subject to being human and human nature. That's important to remember. The other thing is that nothing is perfect, and sometimes as caregivers, we expect too much from ourselves. And at times, the care receiver, the patient expects too much from us, and that is difficult. And again, it's a learning process on both sides. So on top of that, we have natural feelings of sadness, sometimes anger. We feel the impact of change, that our life has changed. We didn't ask for the change. Even when changes are good, change causes stress in our lives. And on top of all of that, especially with respiratory health, we've been dealing with a dreadful pandemic that can affect primarily the lungs, but can also affect other organ systems and systems in the body. It's been a very scary time for everybody, and a very stressful time. Thank God for vaccines, masks, social distancing, thinking things through. But we have a new normal now. Just as when you receive a diagnosis, um, uh, with a big diagnosis, you have COPD, you have emphysema, you have sarcoidosis, all the different respiratory or autoimmune related illnesses or environmentally related. It's big. It's a big adjustment. You don't lose who you are, but you have an extra part of you now. You have your new normal and your old normal combined. And what is normal? Patients often ask me that question, is this normal? Is it normal to be angry, resentful? Is it normal to feel overwhelmed? And of course, the answer is yes. So signs of burnout, uh, and these signs are often also signs of anxiety and depression, which are part of this. But overwhelming fatigue. Fatigue is not just feeling tired, it's feeling wiped out, feeling like your batteries are drained, and simple, easy things that you have done are no longer simple or easy. It takes a lot of effort. And so there is also such a thing as mental fatigue. Uh, Caregivers report having difficulty concentrating. Um, so related to this is depression, which is not just feeling sad or blue once in a while. Depression is a clinical illness that needs intervention through talking, cognitive behavioral therapy, listening, and sometimes medication from a licensed clinician, somebody expert in dealing with those particular difficulties. And so anxiety is actually a good thing, and I'm going to talk about that and how to deal with that in a minute. So the other thing is caregivers often feel themselves withdrawing from family and friends, with the sense that nobody understands what I'm going through, or nobody wants to understand, or unless somebody has walked in my shoes, they can't relate to me. And that is sometimes true. Uh, People who love us and really care about us, even though they haven't been through what we've been through, are sometimes willing to listen. And that's a good thing. Sleep problems, either getting too much sleep, but as a caregiver, you know that you hardly get enough sleep, or trouble going to sleep, even though you're exhausted, what we call phase one sleep, going to bed, and you just can't get to sleep. That is often related to anxiety. The other thing we see is the end of sleep, or phase three, where let's say you normally get up at 7 o'clock in the morning, but now you're getting up at 4 or 4:30 and you can't get back to sleep. That is often related to depression. So that's something to pay attention to, not to be ashamed of, but to notice it and follow it, track it, so that you can get help for it. Sometimes we see people expressing physical sensations, physical problems, such as headaches, stomach aches, back aches, stiff neck, things like that. Always get things checked out. Don't doctor yourself. If something doesn't go away, call your doctor. That's what they're there for. We also see changes in eating habits with caregivers, eating too much, eating for comfort, or not eating at all, just don't care about food. Um, Caregivers have reported to me often that they feel consumed by caregiving, that they've lost their identity, that all they do is take care of a loved one or loved ones, and they feel their true self slipping away, and we're going to address that. Um, there is a report of people feeling helpless, that they can't get help, or they feel hopeless, that they have no hope, that this is it forever, and that they have no power to overcome this. We will address that in one of the next sections here. Um, Feelings of irritability, feeling like you're arguing with people and snapping at people, that you're not regulating your, you want to be able to respond to people instead of reacting to them. Uh, we don't want to be angry at the person that we're caregiving and make them feel bad, but we have feelings too. So that is something that you can work with. And there's no guilt, okay? You heard me say it twice. Guilt is for people who have no empathy and the inability to care. Those types of people, like criminals, should feel guilty, and they don't. You have no guilt. You're there doing the very best you can. Remember that. The other thing that we do see sometimes is denial, either on the part of the patient or the loved one that you're caregiving, um, and that there's nothing wrong. I just have a little trouble breathing. It's okay if I keep smoking or keep not exercising or eating a healthier body and lung diet. That is not a good thing, and we have to address denial directly. You will get pushback, but there's our own denial as caregivers. We get lulled into thinking that if we just give it 110%, everything will be okay. And that's not always the case. We need to stay reality-based, but we need to maintain hope as well. Hope is a very important phenomena. Um, so, how do we prevent caregiver burnout? Many ideas. Some you'll probably think of yourself, but just some food for thought here. Um, if there is somebody in your life who you trust implicitly, it's okay to share feelings with them and to vent. There are other things you can do too, like journaling, um, exercise, staying away from what I call nervous fluids like caffeine and alcohol, um, and stay focused. But finding somebody you trust. If there is nobody in your immediate environment that you can trust, reach out to a mental health professional, a licensed mental health professional in social work, psychology, mental health, psychiatry, and somebody who has a background with chronic illness or with lung disease. That's also helpful. Um, so the other thing is to set realistic goals for yourself um, uh, of what you can get done on a daily basis. None of us are Superman or woman. And so prioritize what's most important, what's second most important, third, and get what you can done on a daily basis, with the including caregiving for yourself, taking a break. There are also outside services, and I know sometimes this is expensive, sometimes it is covered by Medicare and insurance, but what we call respite services, people who will either come in, or a place that your loved one can go to for a couple of days if you need to go out of town, or if you just need a break. Sometimes you both need a break. The other thing is, of course, what I'm saying, don't forget about yourself, your health, because you're so busy taking care of somebody else. People often put off their doctor visits, their wellness checks for men, mammograms for women, all kinds of things, dental care, because you just don't have time. And you don't want to create more problems. So take care of your health. Um, be honest with yourself about what your boundaries are, what your limits are. That's very, very important. It is okay to have limits. You get a vote, even though you're in a very difficult situation or things aren't always going your way. You have power, and remember that. Tell people what you need and tell people what your boundaries are, what your limits are. Educate yourself about what your loved one has, what their disease is. It's always better to know than to not know. You may not like what you learn. You may love what you learn. You may be relieved that it wasn't what you thought. You may get new ideas, but educate yourself. One of the biggest causes of anxiety is lack of knowledge, the unknown. So educate yourself. I already mentioned exercise and sleep, and accept your feelings, even if the feelings seem negative. Feelings are feelings. It's the only way our body, our brain, our nervous system, our spirit has of communicating with us. Pay attention, notice your feelings. Don't criticize them, don't judge them, don't push them away because they'll push back. That is for sure. So, how to care for yourself better. I mentioned anxiety before. Anxiety is one of the oldest emotions in the human brain, goes all the way back to caveman days. And anxiety is part of fight or flight. Do I stay in fight? Do I run? Or do I shut down? And so we don't always have to fight, but we do have to understand what the anxiety is trying to get our attention about. So when you feel that awful sense of anxiety, pay attention to it. It's an alarm, and it's saying something important is going on in your life that you need to deal with. So don't be afraid of it, but notice it. There's that notice word again. Notice the feeling and sit quietly if you can. Relax all of your muscles in your body from the top of your head to your toes, and do a repeated breathing pattern that is very, very helpful. I did some of it this morning myself. So what you do is you breathe in deeply through your nose, hold it, and then you exhale through your mouth like you're blowing through a straw. We call this pursed lip breathing. People with lung disease are very familiar with this. Wait, and then repeat like 2 or 3 times, 4 times. Deep breath in, hold, really expand the chest and lungs if you can, and then blow out very slowly. Not ha, but you'll notice your body relax. You'll notice your thinking clears up. And you ask yourself, after you've done this 2, 3, 4 times, what am I feeling? What do I need? What are my resources? And the key here, or the key word here is what. What do I need? What am I feeling? What is a present centered word? It helps us stay in the present. And that's something that's very, very difficult for most people. We're usually thinking about this afternoon or next week or next month or a year from now. Those things haven't happened. We are here today. We are in this moment, and we need to stay in this moment so that we can be in control, so that we can focus and help ourselves and help our loved one. So anxiety gets our attention. We notice it. A couple more times, and then what? Stay here. Remember a time when you felt confident and competent It's still in there. It didn't go away. Even though you feel overwhelmed at times, it's still in there. It's still a part of you. And we all have times in our history that when we think back, that we did a really great job. We had a sense of confidence. We felt competent. We knew what we were doing. That's the feeling that you need to get back to. It's also important to remember, and this is part of what we call rational self-talk. We all talk to ourselves, even if you're talking in your head about remember to get a can of soup at the grocery store, a dozen bananas, and bread. Make sure it's wheat or multigrain. You're talking to yourself. So how we talk to ourselves um, is very important. And it's important to remember that it's not all on you, this caregiving thing. You are sharing the responsibility with the person you're helping and with other people. Certainly, you have helped other people in the past. Nobody likes to be it. Nobody likes to be the one receiving care, but even caregivers need to receive care. So share the responsibility with trusted loved ones or close friends. They do want to help. They want to be a part of your life. So when somebody says, how can I help? And they don't just walk away, or call me if you need anything, and they walk away, but they stick around and they're looking at you straight in the face and they say, what can I do? Tell them, tell them. They want to help you. They want to be a part of your life. There will be a time when things are calmer, better, or as I say, gooder, and you will be able to share the help. So right now, it is your turn. Um, Let your loved one, the person you're caring for, do what they can do for themselves. An example that I use is if somebody can brush their teeth, then let them brush their own teeth. That may be the only thing that they can do on their own free will that day, but let them do it. It's one less thing for you to do, and it's one thing they can do to contribute to their competence and their well-being. So uh, let them do what they can do. Remember who you are and what matters to you as an individual. That's very important. You're not just a caregiver or a husband or a wife or brother or sister or friend. You're that person who you were in college. You're that person who you were in high school. You're that person who you were as an 8-year-old, 10-year-old. As we develop as humans, we grow like an onion. We don't just become adults. So all those memories and experiences are inside of us. Remember that. And remember what is important to you and don't give that up. So we know in chronic health that we have certainly learned this during this time of pandemic, that we have to learn to adapt. We have to learn to change. It's very, very difficult. Change equals stress, yes, but change is like the word different. Different doesn't mean bad, even though our brain tells us in fight or flight that different may be bad, but different also means not the same. So we are dealing with a new situation. And so instead of running from or avoiding the change, lean into the change, move towards it so you can see what it is clearly. It's not going to bite you. So we embrace the change. And I encourage you to be curious. Be curious about what's going on. Be curious about yourself. Be curious about the person or persons you're involved with. I love that word, curious. Um, it's very motivating. Um, Remember also that in your caregiving, that you're coming from a good place. Sometimes things get so bad it feels surreal, like this just can't be happening. But it's also a time where you sense your capacity for connection to others. You sense your capacity for how deeply you love somebody or how much you are loved in return. There are many opportunities for very wonderful shared moments, however brief they may be, that you might not have had these health situations not arisen. Certainly during crisis, our life deepens. The human brain, although we appreciate good times and happy times, the good stuff up here, uh, and we're grateful for it, we don't learn anything. It doesn't stick to the brain. We do appreciate it though. Where we learn and when we grow, where we really experience our competence and our depth of caring and love is from these times down here. How do we pull ourselves out of a hole? How did we figure things out? What am I learning? That's a good question to ask yourself every single day. What am I learning today? That's very key. Give yourself permission to be human. That is also trite, but it's something that's very true. That we feel that we just have to muscle through everything, that we have to be a robot, that we have to put a smile on our face every day and be positive all the time. That was the old thinking in the 70s, where if you think positively about anything, and if you always have a song in your heart and a smile on your face, that you can conquer anything. And that's not true. But what is true is if you stay focused and think logically, if you embrace hope, um, hope, as you know, is an active phenomena. It's not wishing. Wishing is I would like to win the lottery. Hoping is I'd like to win the lottery and going out and spending a buck. Hope is based in reality. Hope changes over time. We don't always get what we initially hope for, but there is always some form of hope. So um, the it's important to remember that, and this may sound kind of strange, but caregiving is a gift of time and strength. You are offering a gift from yourself to somebody of your time and your strength, um, and who you are deeply connected to. It's a gift that you offer. It's not always picked up, but at least you're offering the gift. You are a witness uh, and a sharer of suffering. That is a truth, that you witness suffering, but you also witness joy when somebody improves, or when they're finally wearing their CPAP every night for at least 4 hours, or they are able to go out again. Um, that is a good thing. It's a chance to be close like never before. It is exhausting. Um, and your job is to be present. Um, it is your job is not to fix everything. That's false. That is unreasonable. Your job is to be present as much as possible, to look somebody in the eyes and just be present. There are no magic words. There's no magic wand, because we'd all be waving it. Do what you can. Listen. The late great theologian and psychologist Henry Nouwen talked about the ministry of presence and the ministry of care. And he said, sometimes with all of our knowledge and all our highfalutin training, the best thing that we can do is be present, be a witness, just listen, be connected. Sometimes that is the greatest gift. Um, so there are a couple of things. Um, Again, our job is not to be perfect. It is to be courageous. This takes a lot of courage. So remember those times. Remember your competence. Remember your strengths. The other thing that I would like to leave you with two quotes that are very important. And I think of these quotes at least a couple of times a week. because as a caregiver and as a clinician, I have my moments. I'm human, and I have to stay in touch with that. So everything that I encourage you to do, I do too. One of the things that I would like to share with you is a quote from Maya Angelou, the great writer and poet and actress. It's very simple. She says, I did the best I could, and when I knew better, I did better. Powerful. You do the best you can, and as you keep learning, remember you're on a learning curve here. You do better. You're not expected to know everything right off the bat. Don't put that pressure on yourself. The other is a quote from Saint Francis of Assisi. Start by doing what is necessary, then do what is possible, and suddenly you are doing the impossible. It's good being here with you. Take good care of yourselves. Give yourself permission to be human. Give yourself permission to reach out, to take a break, to remember who you are, what you've done, and that you've gotten to this point in your life. How wonderful. Thank you.
Thank you so much, Dr. Wolf. That was amazing. And thank you all for watching our Living Better Together COPD webinar series on caring for COPD caregivers. To learn more about RHA's other COPD initiatives, please visit us online at resphealth.org/COPD. And thank you all again for joining us today.